So just before we get started, I wanted to give, hello, I am your coordinator, Jenny Bradford, and I want to give a little shout out to our virtual flash talks, which you can find pre-recorded online on the HAQAST website down here. If you have a chance, I highly recommend it. Ariana Moore's talk on warehouse-related pollution is really great. Elizabeth Joyner's talk about the Pathfinder prototype is also wonderful, and so is Vikas Kumar's talk about machine learning for PM 2.5. So check that out if you have a chance. All right, now I'll hand it over to get this started.
All right, thank you. You want to switch it back to the... All right, good morning, everyone. Welcome to our panel session. My name is Qian. I am an associate professor of epidemiology at the University of Texas Health Science Center at Houston. And we have 4 wonderful talks today. The first one will be given by Dr. Susan Anenberg and Gaige Kerr from the George Washington University. Thanks.
Thanks for the introduction. Everyone can hear me all right and back? Great. So I'm Gaige Kerr. I'm a research scientist at George Washington University. I'll be giving the first half of this talk or so, and then I'll pass things over to Susan to give the second half. The theme of this talk this morning is data and how data can be used for environmental justice applications and some of the similarities and differences that different data products might tell us about inequities and injustices. And if you wouldn't mind going, oh, I can actually advance myself. Thank you. So there's a lot of data out there on ambient air pollution. On the screen behind me, you'll see a collage of pictures showing just a few of the many data sources that exist for different air pollutants. Now, some of these data sets encompass different pollutants, different time periods, different geographic regions, but there are some data sets that tell us the same information or tell us information about the same pollutants for the same region, for the same time period, and with a similar resolution. So just to give an example of this, the EPA data set has information about PM 2.5 at census tract centroids in the US, as does another data set from the Center for Air, Climate, and Energy Solutions, or CASES. Now, these data sets are formed in very different ways. The CASES data set is formed using, I believe, an LUR, a land use regression model, whereas the EPA data set uses their Bayesian space-time downscaling to fuse CMAQ output with monitor data. So a beginner user of these data or a novice user might look at these 2 data products, which are again available at the census tract resolution, and might conclude that they'd give us similar information about PM 2.5 exposure and similar information about injustices and disparities in PM 2.5. But it's very likely that these data sets might disagree in certain regions or for certain population subgroups. So the point of this talk today is to give us a little taste of some ongoing research projects at George Washington University that are looking into this question of what different data sets tell us about environmental justice and population exposure. So I'm going to kick things off and talk about some work that I've been doing looking at different NO2 data sets, and then I'll pass things over to Susan to talk about work that's being led by Drs. Kate Odell and Tess Carter, looking at different PM 2.5 data sets. So we have a variety of data sets and tools at our disposal to understand NO2 or nitrogen dioxide exposure. One that probably comes to mind first for many of us are the EPA's surface level monitor network, which I'm abbreviating here AQS for air quality system. Back in 2019, there were about 450 monitors measuring NO2 scattered around the country, and you can see their locations in this map on the left. Now, these 450 monitors might sound like a lot, and I guess at some level they are, since these monitors are not low-cost monitors that take a lot of work and money to maintain and upkeep. But they do leave a lot of gaps of the country unmonitored. You can see entire states that have no monitors, and in 2019, about 2/3 of all census-designated metropolitan statistical areas lacked any in-situ monitoring. So in addition to this AQS data set, we also have spatially complete data sets that allow us to estimate and understand NO2 levels at every census tract in the US. One of these data sets is a land use regression model that was released earlier this year in a paper led by Susan and Dr. Arash Moheg. And the other is Tropomi, which we've heard a lot about at this conference, which is a satellite instrument that measures tropospheric column NO2. Now, the plots on the bottom show a comparison between the AQS surface level monitors and these two spatially complete data sets, and they tell us that these data sets exhibit a high degree of agreement. So now if we use these three data sets to assess disparities, differences in NO2 levels for different population subgroups, we arrive at really different conclusions. So the plot that you see on the left shows disparities calculated with the AQS monitors. And the method I've used to characterize disparities with these monitors is using the monitor nearest to each census tract. And the other two plots that you see in the middle and on the right show disparities using the census tract average NO2 concentrations from the land use regression model, or LUR, and tropomi. The values you see on the x-axis, the bottom axis, show the NO2 levels for a particular population subgroup divided by the NO2 level for the population weighted average. So if you see a value of 1, that means that that particular population subgroup experiences the same amount of NO2 exposure as the overall citywide or region-wide average. Whereas values less than 1 mean they're underexposed, over 1, overexposed. So now that that explanation's out of the way, if we start looking at individual cities, we can see drastically different conclusions that we reach about population level exposure and disparities. So take a look, for example, at the second row, which shows disparities in Los Angeles. If you rely on monitors alone, you might conclude that the Black population in Los Angeles is underexposed to NO2, whereas the Hispanic and Asian populations are overexposed. But if we take a look at these spatially complete data sets, the land use regression and tropomi, we see a very different conclusion, and a conclusion that's relatively consistent between these two data sets. And that conclusion is that the Black population, the Hispanic population are the overexposed populations. So we could spend a lot of time digging through other results, but I'll wrap up and pass things over to Susan. Just for a couple sentence wrap up, these spatially complete data sets give us a lot of valuable information that surface level monitors miss. And still in 2020, 2021, there's papers being produced that rely solely on surface level monitors to assess NO2 exposure. So in terms of what we can do as HAQAST, I think is communicate better, especially to folks in health sciences, about the use of these other data products. And in addition to that, these other data products might help EPA do work such as trends reporting to kind of fill in the gaps between monitors and assess NO2 for different population groups. So I'm truly done now. Here's the mic.
Okay, fantastic. So as Tracy Holloway said yesterday, NO2 may not be public enemy #1, but it is the one that the pollutant that we can observe most easily from space. I will say NO2 is associated with pediatric asthma development, and as some of you may know, is now being included in the global burden of disease study for PM 2.5 and childhood asthma. So this is a pollutant that does have health outcomes, perhaps as a marker for the overall traffic-related air pollution mixture. But of course, PM 2.5 is the pollutant that is the biggest killer when it comes to the health burden from, sorry, forgot to be in the camera, the health burden from air pollution. So we want to take a look at PM 2.5 as well. I know many people in this room are also working very hard on high resolution PM 2.5 concentration data sets. Some of the people in this room have also compared these PM 2.5 data sets for broad overall patterns across the United States to see whether there's consistency or differences in terms of broad overall patterns. But we have not compared them in terms of the disparities that they indicate for different population subgroups. So Dr. Tess Carter, who is sitting right there, wave your hand, Tess, she had a poster last night that describes this project in more detail. So I hope I do this a little bit of justice, Tess. But we took a look at 3 different data sets that are being used right now. Gaige already mentioned the CMAQ fusion model used by EPA, which has about a 12-kilometer resolution. We have the Van Zonkeler data set from Randall Martin's group at Washington University. And then Haresh Amini and colleagues have developed a 50-meter spatial resolution PM 2.5 data set as well. And so we wanted to take a look at how these compare in terms of the population disparities. These are very preliminary results, so I just want to caveat that, but I hypothesize personally that we would see a lot of differences. These are models that were created using different methods. They have different spatial resolutions. They have potentially even different components, different PM 2.5 components reflected. Taking a look at these preliminary results, honestly, they're really not that different. I don't know. There's a lot of similarities between these PM 2.5 data sets in terms of the disparities that they show between the most Hispanic and least Hispanic populations on the left, and then the most Black and least Black data sets on the right. Just like for Gaige's results for NO2, we can spend a lot of time staring at this and trying to dig a little bit deeper, and we do plan to do that. We have not done that yet. There's a lot of open questions here about the sources that are contributing to these data sets. Are there differences for different regions around the country, given different sources, different important sources of PM 2.5, wildfires in some places, energy production and transportation in other places? We can look at components as well. So this is work that we're just beginning, and very excited to hear feedback that folks may have. Dr. Kate Odell, who is also sitting right next to Tess, a little wave, Kate, also had a poster last night that delved deeper into this project, but we're really excited about these preliminary results as well. We're working with NOAA to understand the value of geostationary satellite data for monitoring air quality, given that they're right now developing a next generation satellite GeoXO, which is planned to launch in the early 2030s, which is expected to be geostationary. So what can we learn from geostationary data versus polar orbiting data for PM 2.5? We're using a data set developed by Shobha Kundragunta from NOAA and colleagues, looking at a full daytime PM 2.5 data set and just the 1 PM snapshot from that data set, and comparing the total observations that we get for PM 2.5 from these different data sets. You can see many more numbers of observations using the full daytime data set, and then the poor air quality days that we get out of those data sets. And we see many more poor air quality days using the geostationary satellite data set compared with the polar orbiting data set. We also see some racial and Hispanic ethnic differences. And this is likely driven by the regional nature of PM 2.5 and where populations are distributed around the country. So just in closing, a lot of this work was done under the Satellite Data for Environmental Justice Tiger Team, which is a very large and lively team of people that is working very hard to really understand how we can apply satellite data for environmental justice in the United States mostly, but also around the world. We have a lot more work undergoing under this Tiger Team than what we just talked about here. And we encourage anyone to get in contact with us. We also meet monthly. These are open calls, and please feel free to join for those calls. And we'd be happy to fold you into the team. So thank you very much.
Okay, maybe one clarifying questions. We're going to save the, okay, no questions. Okay, we're going to save all the questions to the end. So now let's go to our next talk. Dr. Chris Tessum from UIUC. All right.
Hello. So I'm going to be talking about reduced complexity chemical transport modeling. That one. All right. So most of what you've been seeing and what we've been talking about in this conference is looking at satellites. So you have something up in space, and you're looking at what's happening on the ground. Yeah, sorry, right in the middle. All right. So what I'm going to be talking about, is there a way to play the video by any chance? Is chemical transport modeling, which it's a little bit different. Probably a lot of us are already familiar, but for this, you have to have information estimates about the emissions, and then the model will take information about the weather and chemistry and make estimates of ambient concentrations. Right. So this as a maybe next slide. Yeah. And so just to compare, I mean, we probably mostly already know this, but if you have a satellite, the data is everywhere. It's highly accurate, but it doesn't measure everything that you might want it to measure. And you can't, you can look at the present or the past if the satellite was up there, but not the future. For the chemical transport model, you have different pluses and minuses. So it's, you don't have the data everywhere, but you can have the data where you want it to be if you have the resources. Not quite as accurate, but you can predict anything that you want. And you can also look at the future. You can look at different what-if scenarios. So these two things are very complementary. I'm going to be talking about mainly this one model called InMap. And so this is different than some of the models that we've been seeing for the most part in the rest of this conference, where it's kind of, it has a similar idea where you put the emissions in and you get the concentrations out. But it has kind of a couple of different things. One is it tries to directly estimate an annual average concentration rather than stepping through every minute throughout the year. It also has simplified chemistry and physics that makes it run faster, and it has a model grid that is variable resolution, so it's higher resolution in cities, lower resolution elsewhere. And so these things all come together and make it, you know, several thousands of times faster than a more comprehensive model. But the main reason why I'm going to be talking about it here is because we can run it at high resolution for the whole country. And this is important because if you don't run a model, if you don't do a high resolution analysis for environmental justice, particularly, you kind of miss the whole effect. Because what happens is a lot of the disparities in concentration exposure in between different racial ethnic groups happens within the same city in different neighborhoods, often, you know, neighborhoods right next to each other. And so if you do a low resolution analysis, for example, if you do a model run at 12 kilometers, there's only several 12-kilometer grid cells in a given city. So you miss a lot. But once we have a model that we can do at high enough resolution for the whole country to do environmental justice analysis, and it runs fast enough that we can do a very large number of simulations, then we can do a lot of things and look at a lot of kind of effects that we would not be able to see otherwise. So for example, we can look at all the 5,000 different types of emissions categories in the EPA National Emissions Inventory, and we can see that the vast majority of those disproportionately affect people of color. And we can do that looking at, you know, each of around 400 cities. That's this plot here, and it shows that, you know, in almost all those cities, you see the same effect where people of color are disproportionately affected by the vast majority of source types. We can also start to look at, it makes it, when you can run your model very fast, it makes it a lot easier to couple with other models. So we can couple it like within an economic model here and see, you know, a lot of activities that cause air pollution health effects they're not just kind of happening for their own sake, right? If you are generating electricity, you're doing it to meet the economic demand for electricity. You're not just doing it for fun. So you can track that through to the end uses and also the end users of who's using those goods and services. And then what we can do is we can compare the pollution that people are exposed to the pollution that they're causing through their consumption of goods and services. So for example, for Black people here, they're exposed to more pollution based on where they live compared to the amount of pollution that they cause based on what they consume. And same thing for Hispanic people here, and then white people are the opposite. And so when we have a model that we can run very fast, again, you can kind of look at these different impacts in really kind of huge detail and see how all these things are kind of flow through economy to look at each other. One other thing, you know, so far I've been showing you kind of some problems that really exist. So people are talking yesterday about how we've been cleaning up the air a lot. And that's true, but if you look at the relative disparity in between different racial ethnic groups, that actually hasn't changed at all as we've cleaned up the air. So the structural problem has remained. So kind of these previous slides are just kind of showing that problem. So we can also start to kind of look towards what could be a solution. So what we're kind of seeing is that the traditional way of looking at air pollution management, where you kind of manage by source type, like we're doing, you know, managing transportation emissions or managing, I forgot, I'll make it easier. Managing energy use emissions, things like that. But it turns out that doesn't fix environmental injustice. What could happen if you manage emissions by location? So this is a study that's embargoed right now. It's coming out next week. So I'm not showing you the real results, and it's led by Yuzhou Wang and Julian Marshall at University of Washington with a bunch of other people too. But it shows that you can make a big difference if you reduce emissions in a specific location in the city. And look up for that. But you know, I have to be a little bit careful. So this is kind of maybe makes you think that there's a technological solution to this problem. But that's we don't really want to kind of fall into that trap, because what can happen, for example, is here, this is a study by Reagan Patterson and Robert Harvey, which I wasn't involved in at all. But they look at this, this freeway was going through Oakland that got moved for some reason and got moved. Basically, it was going through a Black neighborhood here, and then it got moved out of the Black neighborhood. And so that reduced the pollution in the Black neighborhood, which was great. However, it also reduced the Black people in the Black neighborhood because they couldn't afford to live in there anymore once it was cleaned up. And so this kind of says that it's not really a technical problem that we're dealing with, that, you know, we can, as technical people, we can provide technical support, but it's really a social problem, and it's a problem that has to do with power and representation. And so that's kind of where we need to go to really solve it. Another thing that we can do, we also have a global version of this InMap model now, so we can start to answer some of the same questions on a global scale. So this is looking at, by country, the fraction of the air pollution deaths there that are caused by exports. And so you can kind of see that there's maybe something kind of problematic going on there in Africa, but these are very preliminary results. And so this is led by a student I'm working with, Qian Wang. And so that's kind of what we've been doing and what we can do with this model. I also kind of like to talk about, because it's like a panel, some of the things that, you know, I feel like could be useful to go in direction. So this is one thing, it's an analysis led by Kerr and Gallagher and Tracy Holloway. This is probably not even the most recent results, but the idea is that the InMap model is not super accurate, and the satellite information is. So we'd like to fuse them somehow. Kind of basically where we can maintain the causal nature of a mechanistic model, but also have the accuracy and the kind of consistency with the satellite data makes it more policy relevant. So here's one way to do it, where we can just scale the model output. But there could also be other ways, maybe a little bit more kind of elegant and holistic to kind of tune or fuse the model with the data to make it more policy relevant. Another thing that we can do is make these tools easier to use. So this is an example of a web interface we made for a project led by Susan, working with 96 cities throughout the world to try to look at where the pollution is coming from, and kind of think about what would a more developed version of this type of interface look like. Another thing we could like to do is try to make these models faster. So now you have kind of a comprehensive chemical transfer model that is relatively accurate, but also very slow. And you have like InMap that's much faster, but also less accurate. You know, what would happen, think about how great it would be if we had a model that was both fast and accurate. And so we're trying to kind of go in that direction, trying to leverage some machine learning. So here's an example of just the advection operator as you might envision it being in a chemical transport model, where basically you have the wind blowing the pollution around. This is just in one dimension, and so you have the numerical solver there, and in red, and the machine learned solver in blue. And you can see as the time rolls out in the future, they match pretty well. And so here is on the left, the agreement is pretty good. That's the R² value, and then we can also start to basically make it go faster. All this is something that is just kind of very preliminary work. And this is these results are from a student I'm working with, Monho Park. And so that's, oh, thank you.
Thank you. Now, our third speaker is Dr. Daniel Tong from George Mason University.
Good morning. So I'm not doing EJ, so just like disclaimer, but I'm developing a data set, hopefully will be useful for EJ. So the data set is called NEMO. It's a neighborhood emission mapping operation. It's mostly done by my colleague, Dr. Siqi Ma. She is at another conference today. Okay, so, thank you. So why do we care about neighborhood emission mapping? I think everybody got this question. In my neighborhood, like what are the emission sources? How close they are from me and from my house, from my jogging trails, and also what kind of sources they are. Right. So this project is exactly to answer that question. And I think we started with a very ambitious plan. We're trying to map these emission sources by sector and across the nation. This is at the 1 kilometer resolution. And also I'm working with New York University on the city health dashboard. And they are trying to support 750 largest cities in the United States for urban planning and management. This is also another motivation. And some work done by HAQAST investigators like Dan Gober. He's trying to use satellite data to retrieve emissions, right? So we need to give them a reference, like what is the traditional way to do it and how does the satellite-based data set compare to the other method. So this is another motivation. Of course, you have air quality modeling. We are going to final resolution now. We have machine learning models like the regression models. They're trying to get a 1 kilometer NO2, right? But you also need a fine resolution emission input to that. I think that's going to help you with your machine learning models. So how do we do that? In the real world, we have thousands of emission sources, right? You have cars, you have power plants, you have barbecue, commercial cooking actually is a big source of VOC emissions in the cities. And if you come to Madison, a vibrant city, you can smell food everywhere, right? That's VOC emission. You have to count off this. So in the models, you cannot treat the individual sources. Right? So what we do is building this emission inventory. Basically, it's a total VOC per county. It's a list of that for every species, every sources. So that's the national emission inventory. That's where we get started with. We just got the data from the state, from EPA. And then the trick is how do you assign the county total into your neighborhood, right? So there are many types of emission sources. They all have a different spatial distribution. So we use about 100 GIS maps to do that. And that including population, urban population, rural population, and you got, for example, wood combustion, right? That's more dominant or more popular among the rural population. And also in the cities. You have the roadways and others, and also including satellite data, such as land use, and then also the build blocks. With that, we have a method that we developed, and it's a spatial surrogate. So what is surrogate? It's just a fraction of the emission county into a certain grid box, like 1 kilometer grid box. So that's the trick. All here is in a fraction. So this is where we started with the county level national emission inventory. And then I'm just zooming into New York City because there's a lot of interesting things going on there. And now we have, this is just one of the two of the few, right? We use 100. This is a census tract. And we have AADT, which is the annual average daily traffic. Right? So this is just for examples, right? You can get into the details of the neighborhood level. And after that, this is the final product. You merge everything together. This is only for the spatial distribution. To build a NEMO is more complicated than that. So we have to take care of these three major things. First is spatial distribution. That's what I was talking about. And the next one is in the center is the spatial, the spatiation. So basically total PM 2.5. I just give you one total. People want to know what is inside the PM 2.5. So you need to get a chemical composition for that. So it's for PM10 and also for VOCs and for LUX. So that's the, we're using the EPA species data set. And this is a tool. You can extract the chemical composition information for individual sources. And then after that, you have to assign temporal allocation because inventory give you an annual total, right? But modelers or even for people want to do exposure assessment, you probably want to have the activity time. So that's the three parts. And after that, you merge everything, you get this 1 kilometer national map. On the left is the VOC. VOC follows the traffic because the cars actually emit a lot of VOCs. And you can look at the PM 2.5. It's totally different spatial pattern because cars, highways are not major sources of PM 2.5. The largest source of PM 2.5 comes from dust. It's called anthropogenic fugitive dust. So this is a map, as a monthly map every month. You see that. So I'm also triggered by this map. If you look at the Lake Michigan, for example. You see that for several months, there's no emission over the ocean, over the lake. That's because there's no traffic, no navigation. That's a frozen season. And once the season warms up, you can see the things just the emission just come back. And also you can see the time zones and the people start to walk the traffic. So this is a very interesting way you look at the map. We are also going to the hourly intervals. You can have the diurnal pattern. So for every day, you can see the map. Now you do not see, I forgot which month it's, but sometimes you'll see the half of the lake moving here. That's because that's the clock is started to move. People start activity. All right. So I just want to spend the rest of the time talking about some interesting application or potential applications. This is a part of the HAQAST EJ Tiger team. So I'm contributing to that, led by Susan and Qian. This is one thing that we hope people smarter than me can find a way to use it for the EJ study. And the next thing we're working on is trying to get the heavy duty vehicle emissions and also apply to EJ. This is an environment different from projects in collaboration with Susan and also Dan Horton of Northwestern University. Terry Russell's group is already taking some of the data to do high resolution modeling. So we are looking forward to seeing some results in the future. And then also Dan Gober sent me this nice picture. So he's using chop only, trying to come up with the emission percentage tail. And then now he's comparing that with the NEMO dataset and come up with something that they can reference each other. So this is a very nice work. Hopefully it will increase the accuracy of the spatial distribution from satellite retrieval emissions. All right, so just want to give you a summary of the NEMO datasets. We have all the major air pollutants you can think about. And then we have the PM2.5 and the PM10 composition. So the data is in the SCDL format, also in GIS format, SHIP files. We are still on the fence to think about generate ASCII files, but if that's a need, like for example, you want to have a census tract level NEMO datasets, you can contact me. I will be happy to go to that. It's not a big deal, just like we have not found any user for that. So the inventories for 2017 is the latest one. Now we are working on 2019 and also 2020. The emission sources, we have a total emission. I have shown you what's total emissions, but we have 9 sectors. So you can have individually, like fugitive dust, you can have agricultural, wood combustion, airport. The airport, like Terry Russell was talking about it yesterday, is really getting important right now. Okay, so on the rest of you can see that the data set is available right now. You can download it at the GMU website because it's huge. So I have to warn you for that. You can download the SHIP file, it's relatively small. The hourly file is really huge. All right, to summarize, this is a new data set. We believe it's the first time we had a national map at 1 kilometer resolution from a bottom-up approach. And future, because you think about this, and that other users want to use the data set for high resolution modeling, you want a newer or closer to today's emission day. So we are trying to use satellite-based rapid emission refresh to get a more updated emission data set. I will end here. Thank you.
Thank you. All right, let's go to our final talk by Langston Verdin. All right, hi, from BreatheSMART Wisconsin.
Hey, everyone. So I'm Langston Verdin. I am the Director of Health Strategy at the City of Milwaukee Health Department. Today, I'm talking to you from a different capacity, which is the founder of a group called BreatheSMART Wisconsin, which was really put together out of need a handful of years ago. So the ultimate goal of BreatheSMART Wisconsin is to improve the respiratory health outcomes of folks in Wisconsin, focusing specifically on Black and Brown communities in the Milwaukee area to make sure folks are educated as well as they know what to do when the air quality worsens in and around their homes, their schools, places of work. So the reason I wanted to come and talk to you is really about the project, but it's really important to understand how this all started. So in 2019, I was the Director of Strategic Partnerships at Children's Health Alliance of Wisconsin, which is part of Children's Wisconsin, our pediatric health system in the Milwaukee area. I was overseeing the Wisconsin Asthma Coalition, and in that role, I had access to a significant amount of data that showed huge disparities between asthma-related hospitalizations, ED utilizations in the Milwaukee area, specifically Black and Brown communities in our area. When we mapped these, and I didn't get approval to add the map, so I apologize. But when we mapped these, we saw some really disturbing trends, and a lot of it was following some of the highways in the Milwaukee area. Right, if you know Milwaukee, right up and down the Fond du Lac area and towards the south side, right, where it's a heavily Hispanic community. We had a handful of services that were being planned to address some of these disparities. I'm a big picture thinker. I appreciate those plans, but I'm also thinking, what else? What else might be happening here? Right around the same time, I saw this image. Anybody remember what this is? Anybody want to take a guess? Australian bushfires, right? And so just like many of you, I was glued to the news, right? I was worried about all the koalas and kangaroos and such, but also the people, right? But as I'm on one of these web pages, there was a map towards the bottom, and it showed Sydney, Australia, and it had all these little data points from an organization called IQ Air, and they were looking at real-time air quality at the neighborhood level. So my curiosity starts, going, and I'm thinking, how can I use this in Milwaukee? So I slide the map all the way over to Milwaukee, and there's nothing, right? There's no way for me to look at air quality at the neighborhood level. So I immediately reached out to IQ Air and I said, I need your help. I've got this huge issue here. What can we do, right? Long story short, we built a fantastic partnership with IQ Air. They sent us their sensors at no cost. And more importantly, they connected us with air quality coalitions in other areas of the country to provide us with some real-time, real case examples of how does this work? How do we really just get these a coalition built so that communities who are unjustly impacted have the tools at their disposal to say, you know what, the air quality is worsening, I'm going to keep my kids inside. Or for a child care center to say, you know what, we're not going to go out for recess today, right? There's schools in the Milwaukee area that over 85% of their kids have asthma. So that's important information for them to know. So what we did was we identified some local partners to work on this project with us, right? And so some of these partners are listed on here. These were some of the first folks to agree to post one of these air monitors in their area. The other reason I should say this is important, and the reason I love this this conference is because we have a DNR sensor in the city of Milwaukee, right? But it's on the far south side. And as we are researching this, we are finding that really that's helpful, but that's 4 to 5 miles away from where a lot of these kids live. So while it's helpful, it might not always be meaningful in certain examples, right? So Next Door Foundation's Early Childhood Education Center partnered with us early on. They're a child care center that cares for kids mostly under the age of 8 years old, and they probably have about 300 kids in that center at any given time, right? Pre-pandemic. Lincoln Avenue School, which has a very robust environmental justice focus. They were one of the first add-ons as well. 16th Street Clinics was a really great partner. We did not place a air monitor with them because, again, they have the DNR sensor is on top of their building. So it just didn't make sense to do it that way. Children's Wisconsin was an early adapter. We placed the first air monitor at my house because I needed to test it. I needed to learn how to use it, right? And then at my parents' house who live in the Harambe community. Thank you. And we still have some wish list locations that we're working on to expand. More importantly, I have my best partner in the world, my daughter. So she helped me build these little weather boxes to protect the sensor, because When we first started, IQ Air didn't have their waterproof sensors. They just had these indoor sensors that we utilized for our purposes, right? This is like the 5th iteration. They were not looking this impressive when we first started, right? But that's my daughter, River, who this is a picture from when she's 11. She's now an annoying 14-year-old. I still love her to death. And so this is one of the sensors that's placed at the Lincoln Avenue School. We utilize IQ Air's platform. It's super easy to use. And what we found was that our families knew how to use it, right? They could set up notifications on their smartphone that would tell them air quality is worsening. But more importantly, what to do when the air quality is worsening, right? On the back end, what then we were looking at is comparing some of those hospitalization trends with the data that we are finding from our air quality sensors, right? This is the data that IQ Air is able to gather for us on the monitor. We had some challenges though. So because of COVID, right before this, so this was late 2019 was when this project got started, right? So the storm hadn't yet come. We're gearing up, we're building the kind of infrastructure, the planning, and we had the childcare centers that were on board. We placed our first set, the first monitor, and then when COVID hit, we, the childcare centers and the schools closed. So we didn't have a point of contact in those schools at that time, or the childcare centers at that time, to be able to set these up. When they finally start coming back online, we also started running into some issues because of ransom attacks on hospitals and health systems. So they were totally not on board with us hooking up anything to their Wi-Fi because it could be a potential threat and cost them millions of dollars, right? So we had to go through a lot to get that going. What we also found is we had a lot of really, hopeful folks. They wanted to do this. They had a childcare center. They had a community center, but they didn't own their building and there wasn't an outlet. And the landlord said, nope, I'm not paying money to do that. So we had to jump through a lot of kind of loops and find new partners, things like that. When we were able to get started again, staff turnover at some of these places was another issue, right? So we got staff trained and then they left and we had to kind of start over. So it's been a challenge in that sense. So what now? So I'm really excited to partner with Chris and Tracy on some environmental justice focused work to look at all the work and the data that you all are collecting so that at some point, I don't have to go childcare center by childcare center to try to get these placed, right? We can utilize the data that you all are collecting to do that. What I'm really hopeful for and cautiously optimistic about is that science will come up with a really cool platform for our families to do that, right? I was in a presentation yesterday and folks were talking about case study and validation. I appreciate it when I'm in this room. My families don't care about that, right? They need a tool that they can trust, that's useful, and lets them know what to do in that moment. And so really, really hopeful that we'll get there. We're regrouping right now. We are identifying a few more sources. I did a presentation on Wednesday to talk to with community partners about this. So we'll be placing some more monitors that we have available, kind of having the conversations about like, do we make this an official nonprofit or not? I'm not sold on that. We'll see. But we'll continue to collect more data that we'll be able to use as it relates to our partnership with the Department of Health Services and their asthma team over there for us to be able to move forward and figure out how this is impacting those asthma outcomes. So this is me, my contact information. If you all are interested in reaching out, I'd love to chat more. So thank you.
Stay here, and all the other speakers, please come up. And we're going to start our Q&A sessions. Here, one more chair. Oh, all right. Oh, sorry, blocking your way. So, questions.
Should it be green or red?
I like green.
Green, that's great.
Oh,
Yeah.
okay.
As the audience, if you want to talk about
All right, questions, anyone? I do have questions, but I want to give other, oh, okay. So, is this one?
Yeah.
For Daniel, okay. So the question is, what are the profile surrogates for hourly emissions?
This is based on the NEI 2016 platform. So that's provided by EPA.
Okay. Please.
A follow-up question to Dan. So have you, there for 2017 for that EPA platform, there's been a number of 1.3 kilometer resolution data sets put together. Have you done any comparison with those yet?
Yes, we did that's a good question. We did compare to the EPA benchmark data set that they released. So for most of it, it's like very close, very, very close. The largest difference is 0.03%. So very tiny in any country.
Have you looked at that sector specific difference? Because I know like the on-road heavy diesel was one of the ones that I know the inventory collective was concerned about.
Yeah, we did look into that. We did a very thorough comparison in collaboration with EPA. So AQPS, so we work with Edison S
Gilead.
on that. So this is really we got a lot of help from EPA.
Easy.
First, thank you all. This was really an amazing lineup of talks. And, one theme that I feel like came up is trust. Like, where do we trust the data from? And I'm wondering if maybe each of you could kind of comment on what makes a data set trustworthy for communities. And I feel like that is very different than what makes a data set trustworthy amongst scientists. And, I guess just sort of thinking about how we as a scientific community can kind of reconcile those, because we don't want to publish and promote things that we don't trust. On the other hand, we don't want to stall out waiting for perfection if our definition of trust is different than what could really help people.
All right. Data trust. Anyone want to go first?
So I'll jump in. So from my experience, I think most community members, your average residents just working hard, right, and going to school or whatever, they trust the information that's in front of them. So if it's presented to them in a way that's seems legit, it's especially from a scientific standpoint around like air quality, that's so above a lot of people's heads that it's you show me this, I'm going to believe it, right? And so especially when they have experience and so much just life experience as it relates to like asthma and things of that nature, right? That when you tell me I have a tool right here that can help you, it didn't take much convincing for me as I'm meeting with family members, as I'm meeting with daycare centers when they have an 80% asthma rate in their schools. It could have been IQ Air, it could have been a website. It truly was only IQ Air because that was the map that I saw on NBCnews.com, right? So that's the direction I went. And so it didn't take much convincing in my case. Yeah.
I'll just add that that exact question is the reason we're doing all these comparisons of different data sets, just to understand, are they even pointing in a consistent direction? Are there inconsistencies that maybe we can learn from and figure out, what is the methodological differences that led to those inconsistencies? But I also, one of the things that has been most insightful, I think, and sorry, Gaige, if I'm going to steal your thunder, but Gaige and our colleagues have done all this comparison with the monitors and found that the satellite NO2 compares so well to our AQS monitors, and yet our AQS monitors are so sparsely located. I don't frankly really trust those comparisons as a scientist. So I would like to see something, we compare these multiple spatial, spatially complete data sets. That's very useful. But one thing that we've been doing at the Environmental Defense Fund is hearing feedback too from community members. Well, this doesn't line up with our understanding of where the sources are. And that's super helpful for us to understand, these national scale or global scale models that we're developing may not be incorporating on the ground information that the community members know about. So it's that feedback that has been, really helpful for me, at least on the trust building side, and hopefully for the community members as well.
You did steal my
Oh,
thunder, so
sorry.
no, it's okay, it's okay. You said it better than I would, so I'll pass things to you, Chris.
Maybe I can comment. There's another project I'm working on with Susan where we're trying to provide information to city governments, and there, the information we're providing them, especially like kind of in a global context, is probably not super accurate. But to be honest, otherwise it's nothing, right? So, otherwise they wouldn't necessarily be able to consider air quality in their decision-making process at all. So at least for my thinking, it's as long as we don't think that by providing the information that we're going to be causing harm by, telling them to do something that's completely the opposite of what they should do otherwise, that as long as it's better than the information that they would have without it being provided, then I think that's okay. Because a lot of times, when people need to make decisions, the decisions need to be made on a lot shorter time frame than we're often able to provide the kind of very bulletproof scientific information that we're most comfortable with. So there's that kind of disconnect of timescales, I guess, and also resources, where a lot of city governments, especially like if we work in Johannesburg or something like that, they don't have necessarily the political will to allocate the resources to doing kind of a very robust GMAX study of the air pollution in their city. So the question is, what can we provide at a lower level of resource intensity and time?
Yeah, I agree. I think for me, it's really a question I resonate a lot. When I was doing my postdoc, my research project was to calculate green GDP. So we try to calculate emission from concentration to exposure, health impact, and assign a dollar value to that. When I look at the whole cost effect chain, I saw that so much uncertainty on each step. So that drove me back to the physical science. And now I want to go to the source of uncertainty, which is emission. So I spend most of the time of my career right now doing emission, including the NEMO, so just one of the examples. For me, I think even for emissions, right, people treat data set from EPA secret and basically the truth. However, if you really dive into the black box of emissions, you can see there are so many losing ends, like emission factors, activity data sets, and how do you aggregate temporal variation, spatial distribution, all plays. To me, I think it's extremely important your piece of research. You have to understand the details of the data set, and then also know what you do not know, right? That uncertainty level, and communicate the level of uncertainty to the user. I think that's the fair service for us to the community and then also to the public.
Thank you. Right.
So I think my question is probably directed at Langston. I'm really interested, you sort of brought up the importance of having like an easy to communicate phone app with the instruments that you're providing data to individual people too. And so one thing that crossed my mind, since you mentioned working directly with hospitals as well, and kind of you had in your, it sounds like in your prior position, access to the data where you were able to see like, okay, it's these communities that are having higher than the normal or whatever normal is problems with asthma. And so I guess my question for you is, when these patients are coming in, with asthma attacks or whatever the symptoms are they in the medical sort of treatment, is some of that communication about you should pay attention to air quality? Or is there sort of a missing link there where it also is part of kind of how we manage as a health system, how we manage asthma? Is there communication that needs to be done with the medical community, and like, do we need to get tools in their hands too? Yes, sir.
Yeah, definitely. There. So when I work with children, I was part of the population health management team over there. So we dug in really deep with new interventions and ideas related to how do we improve health and well-being of populations, right? Population health work. And that was just not there, right? There was no, you have asthma, you live in this community, let's prescribe these services, right? Or let's assign you these potential interventions or preventions. Often it comes down to funding, right? How do we fund these additional projects or programs or services within communities? Children's has, I think, 10 or 12 nurses in Milwaukee Public Schools, right? And so I know those folks are really well aware of asthma and how to treat it and some of the local triggers, but as it relates to how air quality might impact it, it's kind of up in the air, right? And it's individual. You may have a nurse who is very well and knowledgeable in that area, and others who just, it's just not their scope, not their expertise. It's the kid in front of them. So there's definitely some opportunities to make sure that those folks have the tools so that they can be proactive.
Can you hear me? Of the power dynamics that keep some racialized groups living in the most polluted areas. And I love that you mentioned that, because a lot of times we focus on measuring the problem. And that was one of the first mentions of trying to solve the problem. What are some of the power dynamics and some of the things that are modifiable that we can start trying to identify in addition to measuring pollution that could help increase exposure in different sections of the population?
Sorry, that's me and Chris. Thanks. I'll just start that by saying that, yes, absolutely, this is more than an air quality problem. And that this is somewhat of a challenge of our fractured governance structures, is that we have certain people in charge of certain things and they're all interconnected. And so we have to make sure that there's lines of communication across people who can actually affect change. That might be within the government, it could be within the government and other, community members and other groups as well. I also think that this is something that we are starting to measure now, but we have not been measuring it. And so when we have a Clean Air Act that is touted as being highly successful, yes, it was highly successful in what we're measuring, which is regional air quality. And that has led to a challenge where we still have these dramatic disparities within cities that we were not measuring before. Now that we are measuring it, that is a metric that we can add to our metrics of success for governmental programs.
Yeah, I guess I would just add, I think often about who's been excluded in studies and surveys in the design and the process that we're all talking about, right? It's no surprise when you had mentioned the redlining in your presentation yesterday. The same communities that I was talking about in the Milwaukee area are historically redlined communities. They're communities that have been disinvested in over many years. And I think this is just one piece of the puzzle, right? It takes investment in these communities for all kinds of conditions and needs that has to take place. And so I think it's important as we investigate these air quality issues, other concerns within these communities, that we take an approach of actively anti-racist in our work. And if you don't know how to do that, find out, right? And start that work. I think that's an important piece of the puzzle.
Yeah, I think that kind of the core thing behind all of this is that it's a manifestation of racism and white supremacy. And we can make all the measurements we want, but unless we grapple with that core issue, they're not going to help.
I think there's still obviously a lot of work to be done, but it's refreshing to hear at least some discourse from politicians about righting these historical wrongs. I'm thinking back to the Build Back Better and Mayor Pete talking about reconnecting communities that had been kind of fractured by highways and interstates when they went in. So more policies like that, I think, can benefit from the data and insights that we provide and start to affect change.
Other questions? Please.
So, thank you for the talk. A lot of the data and some of the knowledge is more applicable to what's happening now. We do we do a lot of prospective analysis. Within that kind of time frame, there are a lot of changes that are and to a certain extent that obviously changes how the environmental questions can be defined. So if we, for example, go and take a look at gallium nitride stream, gallium nitride stream was the 3G was based on data around there is a universe. There are differences in those data sets, and that can obviously lead to differences in conclusions based on them. And if we think in terms of just as important initiative, which is like again perspective, and likely to impacts of 20 or 30 so are there thoughts on like how these data sets can improve for prospective analysis at those time points?
I can start. Yeah, the question was about prospective analyses out to the 2030s, 2040s timeframe, given that a lot of the things that we talked about here today were about current conditions, which can change quite a bit, both in the demographic side, the socioeconomic side, as well as the pollutants, pollution level side. And I completely agree with you. You know, something like the Justice 40 initiative, which aims at 40% of the benefits of governmental programs going to disadvantaged communities, that requires prospective analysis. To do prospective analysis, we can't observe that. That's something we have to estimate or model. And our models are typically at 2 cores of resolution to capture neighborhood scale pollutants, which is why Daniel's work is so important. And the other, folks on this panel is so important to develop the emissions data sets that can feed into high resolution models, so we can get to a higher and higher spatial resolution of the outputs as well. I was lucky enough to just chair a EPA Science Advisory Board committee on the heavy duty vehicle NOx emission standards that were recently proposed by the EPA. And there is a distributional analysis, those analyses of costs and benefits go out to 2030s, 2040s. There is a distributional analysis in that regulatory impact assessment, but it's based on 12-kilometer modeling, which isn't high enough resolution to capture those distributional impacts. And our committee is recommending that EPA develop a agency-wide strategy for including distributional analyses into regulatory impact assessments so that those can be incorporated in the future. But it really requires all the efforts of the people in this room to develop the modeling tools to enable that to happen. Right now, these are national scale assessments that they need to do. And we can't currently run 1-kilometer modeling on a nationwide basis. So it's really the work that everybody in this room is doing to advance those modeling tools is really important for those types of prospective assessments.
I could say, one thing to think about is kind of what kind of predictive power we have in 2040. And in some things it's maybe some, but I think in a lot of areas it's nearly zero. If you think if you kind of look at, for example, the Energy Information Administration kind of have this track record of being completely wrong, year after year, especially with solar power, that they're just completely wrong. And I think that's and you can pick on them, but that's one of the things that actually gets kind of ground truth afterwards, and people look back and say, were they right? A lot of these other things, nobody actually make these kind of prospective projections, but nobody actually checks whether they're correct or not. So I think, maybe it's like a different way to think about it. Instead of trying to predict what is going to happen, we can just say what do we want to happen and what would need to happen in order for that to come about. And so we can use modeling to do that. Say what would need to happen in order for us to meet some sort of goal. And we can also say what's something we want to avoid, and you know, how can we, you know, what would, you know, if there's a thing that we want to avoid, what kind of different ways could that come about, and so we can know to avoid those. Because otherwise, you know, it's really hard to tell. Like there's people have talked about redlining, which is where basically Black people and people of other were called unharmonious racial groups were basically kept out of certain areas and continue to be to a certain extent. And so that has been shown to be like extremely stable, actually, where that actually hasn't changed very much over time. But you know, some other things have changed a lot, you know, and so it's really nearly impossible often to know which one it's going to be.
Yeah, I just want to follow up on that. I agree with Chris that, for example, just energy sector, right? We use UE annual energy outlook to project emission, but sometimes it's not very accurate, especially if you look at the short term, because you cannot predict the COVID, you cannot predict another recession coming. Right, things like that, all the momentum of electrical cars, for example. But I'm getting more into this ensemble approach, like probability prediction. Maybe this is a way we're going to go for weather conditions, for emissions, for the social economic factors. So this is probably all the community have to work together and then predict the different scenarios. And in combination, maybe you will get a bracket of what's going to happen in the future.
Please.
Yeah, I have a question about engagement with the communities, and you know, this is a bi-directional communication, and I'm wondering about surprises that you've learned or lessons learned where you've engaged with the community and their concerns are completely different from what you expected, or you've unearthed some concerns that are really important that you completely had no idea, and actually shifted your research around that.
Well, I mean, I haven't, you know, I'm just learning. One thing that I've been told though is that people in the community are not often quite as enamored with graphs and plots as we are. And they, you know, may not actually mean anything to them at all, to be honest, or may not, you know, provide them actionable information. And often that they're more interested in stories, and kind of like what are the, you know, impacts on an individual level of these things, and you know, what's the story, what's the narrative of it, and that can be something that's very uncomfortable to deal with for scientists, or like, well, the story doesn't matter, right? I want to know about the facts.
I'll just add one thing that we haven't had the chance to research yet, but just remains top of my brain. Back when we were forming the Tiger teams for HAQAST, we did these open listening sessions, which were fantastic. And we did one for the satellite data for environmental justice team. And one of the things we heard was we sort of gave some information about what's currently possible from satellites, and then opened the floor to hear what community members, you know, are interested and concerned about, want from us, you know, could use from us. And one of the comments was, well, this, you know, NO2 is great that you can measure that, but we're concerned about hazardous air pollutants. What can you tell us about hazardous air pollutants? And that's not something right now that we're set up to do, but maybe is something that the, you know, people in this room can figure out. Is there a way to use what we're good at measuring from space to get at this, you know, concern that this real concern about another set of pollutants that community members care about?
I think we've had a lot of great information about providing tools for community and providing people along the way and education. But I wanted to hear your thoughts on single information. You've given them the tools, you've given them the dashboards and all these great apps for them to use, but how do we keep them engaged? How do we further responsibly their understanding of the issue outside of, you know, my kid has asthma, my mother has to, I want to manage that. So
So what are some tools and resources and solutions that you have come across in your area of expertise or in your career that kind of help to further this conversation and keep the trust in the community outside of here that
So from the work that I'm doing, I think it's important to acknowledge that specifically around asthma and respiratory issues, that's only one part of the challenges in their lives. And so having a conversation that is open to learning more about them and what else is happening. And I might not be the expert on rent assistance programs that might come up in that conversation, but how can I, from a human level, connect with them about the things that are troubling their lives, and for me that's the part of the relationship building, not just how many people I can provide education to on air quality, right? That's not to say necessarily that I will ever see this person again as an individual, right? Or be able to connect with them again. But it just helps build trust that I care and this is why I'm doing this work. And I think in the long term, for me at least, that matters. It personally, it feels better to not come in one-sided to these conversations. And I'm hopeful just from a population lens that lends itself to better outcomes overall.
One of the action items that we've been doing as part of this satellite data for environmental justice Tiger team that Susan mentioned is not just communicating with community groups and other end users, but talking with folks who maintain well-trusted tools. So we've been speaking with folks at the EPA who deal with EJ Screen and at other state screening tools. And our goal with those conversations is not just to add another tool to this mix of tools, but to plug into tools that are already widely used by community groups that are already trusted. And our hope is that even when this Tiger team ends in a few months, that by plugging into these tools, that some of the advances that we make can be sustaining in the long term.
I guess one thing to always consider is like, what are the incentives or infrastructure that we have as faculty members or government employees to engage with the communities, and kind of what level of resources or funding is there to do that. And so HAQAST seems like a very good program that kind of to incentivize these things, but it's probably more an exception than a rule. And kind of, in universities, universities are maybe starting to change their kind of incentive structures a little bit to focus more on engagement and outreach, but there's still a long ways to go. Kind of maybe a model is a lot of universities, especially land grant universities, have extension operation. And so they're usually agricultural extensions, and at least around here. But you could take a similar model to be more like a community kind of, environmental justice type of or social justice type of extension, where there would be actual resources and people, committed to the kind of continued engagement with the community. I haven't seen really that. I know I've seen public health extension too, which is similar, but that's something that could happen that hasn't, I don't think.
All right. Unfortunately, we're coming to the end of this session, but there's great talks and great discussion. So let's give our panelists another round of applause.